Okay. Good morning, everyone. Welcome to the second roundtable of this workshop. The roundtable is titled AI Meets Medical Imaging, Call for Interdisciplinarity. My name is Lara Cavinato. I'm assistant professor at the Department of Mathematics here at Politecnico di Milano. And today with me, we have 5 distinguished speakers that I will introduce in a minute, because before diving deep into the discussion we have prepared for today, I must acknowledge 2 of the revolutions that have brought us to the medical imaging as we know nowadays. The first revolution is was witnessed in 1895 when the Nobel Prize winner Wilhelm Röntgen discovered X-rays. Since then, we have progressively started to search and sweep the entire electromagnetic spectrum, and we have managed to acquire different imaging modalities ranging from, for instance, X-rays with computer tomography, but also the microwave with ultrasounds, if it does, okay, radio frequency with magnetic resonance imaging, or also called MRI, also with invisible spectrum with optical imaging, and 2 gamma rays with scintigraphy, SPECT, single proton emission computer tomography, and PET, positron emission tomography. So we have progressively acquired this capability and knowledge to look into the human body, deriving information about anatomical, molecular, and functional information of all the entire body. And by looking into, with our eyes, into the different structure of that builds human body, basically, we acquired information and knowledge to cure, ultimately, the patients and know the diseases. The second revolution I want to talk about has taken place in 1972 when the PACS was introduced. PACS stands for Picture Archiving Communication Systems, where all the imaging modalities that have been discovered and built throughout the years could be stored in a ready-to-use way in clinical practice. And this has actually built an infrastructure that every hospital has, and this has allowed us to basically have access, direct access in daily practice of tons and thousands of information to which to focus and route basically the clinical practice. And this is available and ready to be used in every workstation of the hospital, every laptop, every tablet, and to every persona that basically has the knowledge and the access to this kind of information. I think that we are now witnessing the third big revolution that AI is basically bringing to medical imaging as well as other fields in medical analysis. And the AI that meets medical imaging actually can bring a lot of challenges and opportunities for precision medicine, to bring and build precision medicine tools. Of course, with all the opportunities that this big third revolution is bringing, it also brings some challenges. Today, we have 5 distinguished panelists that with me will discuss and tackle some of these challenges that we are facing. So I'm reading your bios, just not to forget anything. So we have here at my right Professor Arturo Chiti. He is the director of the Department of Nuclear Medicine at St. Raffaele Hospital in Milan. He's also a full professor in imaging diagnostics and radiotherapy at Vita Salute San Raffaele University in Milan. He has served as editor-in-chief of the European Journal of Nuclear Medicine and Molecular Imaging. He is also the former president of the European Association of Nuclear Medicine, and where he has been active for over 10 years. His research interests include nuclear medicine and AI in oncology, especially lung cancer and prostate cancer. Following, we have Dr. Francesco Fiz. He is a medical doctor specialist in nuclear medicine at the Galliera Hospital in Genoa. His research focuses on advanced imaging research, collaborating with mathematicians, engineers, and data analysts from various national and international institutions. His main research interests lie in applying machine learning approaches as support tools in diagnostic and developing the so-called visible radiomics to integrate textual analysis into clinical practice and enhance the information provided by medical imaging. Following, we have Dr. Sara Garbarino. She is a tenure-track assistant professor at the Department of Mathematics of University of Genoa, and she's a researcher at the Life Science Computational Laboratory at Ospedale Politecnico San Martino in Genoa. She has extensive experiences abroad, including the Centre for Medical Imaging Computing and University College London, the Université Côte d'Azur, and Indria Institute in Sofia Antipolis. When she returned to Genoa, she co-founded the Life Sciences Computational Lab at Politecnico San Martino, where mathematicians, physicists, statisticians, and bioinformaticians work directly in the hospital environment. Her research focuses on combining AI with biological modeling of brain pathology. We have Dr. Antonio Gatti. He is the EMEA Regional Managing Director for Pharma, Life Sciences, and MedTech Industry at Microsoft. Within his endeavor, he partners with large pharma and life sciences companies to foster and support their adoption of AI-enabled scenarios and ultimately the transformation of their business operations. Lastly, we have Professor Maria Gabriella Signorini. She is a full professor of bioengineering at Politecnico di Milano. Her research focuses on biomedical signal processing and AI-based model to improve healthcare and medical devices, with application in fetal monitoring, dialysis, and cardiovascular diseases. She has led the biomedical engineering PhD program, and currently she serves in the academic senate. She is the founder of the Data Cloud Lab, and she also serves as associate editor for several international journals in biomedical engineering field. So we welcome them on stage, and we are ready to start our discussion. So I would like to first start with Professor Arturo Chiti, tackling the challenge that we have from the clinical point of view. So we know that imaging departments, including radiology, nuclear medicine departments, but also pathology, are becoming foundational for nearly all clinical workflows. And this means also that there is a surge in both data volume and workloads. So how is this transformation affecting daily clinical practice from your point of view, and what role can AI play in managing the increasing demands while also, of course, maintaining quality and efficiency? And what are the biggest challenges in implementing AI-driven workflow improvements?
Thank you, Dr. Cavinato, for the kind introduction, and I would like to thank all the organizing committee and particularly Professor Yeva for inviting me. This is a great pleasure to be here at the Politecnico, and particularly to see so many young faces, young colleagues. So, you know, being a medical doctor dealing with images, I started, let's say, 10 years ago in try to understand if we were able to get something more from the images that we are treating. So, you know, there was this big hype of radiomics. So after radiomics, we bumped into AI, and I think that it's very positive that nowadays we see something. We listen carefully with the terrific talk that Dr. Ayace gave us this morning. So there is a lot going on, a lot of promises. I think that we will get there. And the nice thing, the interesting thing is that nowadays we have more interactions. Because if I came back again 10 years ago, we were seeing that, you know, you as data scientists and engineers, you were going in a direction which was not definitely aligned on the need that we as medical doctors, not only medical imagers, we had at that time. Nowadays, there is a lot of synergies. We are doing a lot of collaboration. And again, this morning, we saw successful collaboration, not only from a theoretical point of view, but also, and this is most important, for the applications. So I'm really enthusiastic about what is going on these days. I think that we are testifying a change in medicine. So medicine started as an art, then became a kind of a science. It's not really a science, but it might really become even more scientific. And the real advantage that I see for the future is that we will be able to give a care to every patient which is aligned. Because at the end, we as medical doctors do not have to forget that we are here and we are paid for giving a better medical care to every patient. This is not true nowadays. It's not true in the countries. It's not true in Europe. So if you are treated in Milan, you have higher chance to survive than if you are treated in a small town in the south of Italy. If you are treated in France, you have a better chance to survive than if you are treated in Romania. So this is something that AI can work on. That means that we should be able to design tools that allow, and we had seen some examples, this also in the last presentation, for instance, from Professor Loiacono, that allow to, let's say, increase the level of the healthcare that we can give in every country. Having said that, as you can see in this, of course, artificial intelligence generate image, there is still a huge problem on the infrastructure. So we are getting a lot of data. Most of the data, they are not collected at all. They are not curated. So it is very difficult to harmonize this data and to use them to, let's say, build artificial intelligence tools that we can use in every day. And also, there is no interoperability between the different hospitals. For instance, in these countries, in this region, we don't yet have a regional PACS. Lara, can I call you Lara? Okay. You know, I know this lady since, yeah, she was feeding, they were feeding her with milk. No, not really, but anyhow. So we don't even have a regional PACS. So if I have to see images that are taken in another hospital, it's the main problem. It's not. So sometimes I have to ask the patient, go and get the CD and get it back to me. So there are many problems that we have to focus on in order to have this incredible tool to be developed and to be available for all the patients. Because again, coming back to what I've said before, the main goal is to increase the level of patient care. And we don't have to forget this. So I think that we have to demonstrate that the AI tools are really effective and we will, because I'm 100% sure that AI tools are effective and will even be more effective to treat patients. And we have to push to the authorities in order to get the infrastructure that we need. Again, I also comment on your talk this morning. So, for instance, I'm working at the San Raffaele, which is not the worst hospital in the world. It is not the worst hospital in the country. But to make a report, I have to use 3 different tools, which it's, you know, it's really time-consuming and makes no sense. So if we really have to implement AI, we need to work also on this infrastructure. If you go to main hospitals in Shanghai, China, that were built, of course, definitely earlier than, after the San Raffaele they were built. Nowadays, if you get a CT scan, you don't get the images. You get the images and the report. And then you artificial intelligence generated the report on the images, and then you work on the report. Of course, this increases not only the efficiency, but also the quality. Because, you know, then this is something that I always say. So then I get tired. So when I'm at my 15th, 20th report a day, then the telephone rings, then I have, I don't know, to get something to drink or whatever. So I get tired, I get confused, and the quality might decline. So these are all aspects that we have to take into consideration. And again, I want to underline that I'm not saying that we don't have to take care of the cutting edge science, because this is the only way to drive the process and to convince the payers and the authorities that we have to implement this in the clinical practice. Now we have some examples. Most of the examples of the AI that we are using are on board of the scanners. We are talking about medical images now. The new generation of scanners have AI on board. For instance, one of the, let's say, bottlenecks that we have for MR is that MR is quite slow compared to CT or to PET. But nowadays, with the new artificial intelligence tools that you can use in MR, the time that you need to scan a patient, it's really reasonable. And of course, it's definitely better for the better use of the scanner. But still, we have few of these scanners available. Again, it's a problem, at least of these countries. It's not a problem in France, because we have a nice law that don't pay an examination which is done on a very old scanner, but unfortunately we don't have it in Italy. And we are still struggling with very old scanners. And again, it's not because they are old, but it's because the quality of the images, and that means the quality of the care that we can give to our patient is not enough. So to conclude, I don't know how much time I have, okay, but anyhow. To conclude, again, AI is happening. Luckily, in some centers, it is really already helping us to give a better care, but we have to work on the infrastructure. This is my main message. Thank you.
Thank you very much. And also, just a little bit advertising, as European Association of Nuclear Medicine, you also have implemented the AI initiative, bringing the aims at bringing AI into the fields, right? So at patient level. Okay, so we know from this introduction that working with that medical imaging is bringing to the table the need of interdisciplinarity and to make working together people from different backgrounds. I would like to ask to Dr. Fiz, since medical imaging is becoming increasingly interdisciplinary, from a clinical perspective, what specific skills should medical imagers acquire to work effectively with AI and computational methods, engineers and scientists, and how should medical imaging training evolve to reflect also this need?
Thank you. Okay, so thank you very much, Lara. I would like to thank the organization of the Congress. It has been really exciting so far. It's an honor to be here, and I would like to thank Professor Yeva for the invitation. To address your question, I think that the most important skill that one radiologist or medical imaging specialist should have is communication. You have to know first which problem do you have in your daily practice, and you have to communicate that to the people developing the AI solution, the new software that will help you solve this problem. And you need to be able to provide a constant feedback to them. So there's going to be a dialogue between the clinician, the imaging specialist, and the software engineer that is developing the AI tool that you will use in your daily practice to tackle a specific issue. And communication, I might leave it at that, but of course you need a whole, to be more efficient in this field, you need a whole set of skills. Of course, you should know about model building, that is, you should be prepared in statistics, and you should know also the ins and the out of the legislation regarding clinical trials, because much of this AI, it finds itself still in the research domain. So you should know how a research protocol is created, how do you bring it about, and how do you complete it successfully. And having said that, I would like to just to provide you a short overview of the AI application that we have in our practice and about those that are probably coming, starting from those that are already implemented that can be used in our practice. So the first one is for sure lesion segmentation. So medical imaging, many times you have to know to segment the volume, so to know how much disease burden do you have in any given patient. But of course, as you know, segmenting a lesion manually is a tedious and time-consuming process, and it's very hard to do that, especially when you have a patient with a lot of lesion, like more than 100 in some cases. So luckily, AI can help us with this problem, and there are software that are used today to provide an accurate segmentation of the tumor volume. And two examples that I can give are prostate cancer. Prostate cancer, advanced prostate cancer, is a disease that manifests with a widespread metastasization. That is, the patient develops many secondary lesion within the bones, the lymph nodes, and other organs. So, and it can evolve quite fast. That is, the patient can progress or can respond really fast. And these variations in volume are important in determining whether the patient will respond or is responding to the treatment, and to guide the treatment. So having the computer do that, just doing an estimation of the tumor burden, is very important to the physician. Another field is lymphoma. Lymphoma is also a disease that is very widespread, with a lot of localization, with a very large volume. But more importantly, when you treat a patient, you might have a full response, or there can be some disease that remains hidden, or just a minimal amount of disease. But even a minimal amount of disease prompts further therapy, chemotherapy, radiotherapy. So having the computer tells us, segment the volume, and then tells us that there is some disease left is very important to us. These applications are almost already available and can be implemented in most systems. Then AI is really good at enhancing the images. So no, just the previous slide, just the bottom row. So image enhancement can increase, for instance, the sharpness of the images, allowing us to see more details, or can also generate some artificial thin slices to see smaller structures. But an application that I really care about is the reconstruction of images with low dose or low activity. For instance, in pediatric patients, like children with cancer, like Hodgkin lymphoma, neuroblastoma, they have to do a lot of scans. They have to do repeat scans over the course of their treatment. And many of them can actually be cured. So the radiation burden in these children is really important. And as you can see here, AI can reconstruct images with low counts, with low activity, to make them more sharp. So I can retain the same image quality with a very, very, very low dose to the patient, which is really important in this setting. This is also an application that is it is there, and it can be used, or it will be here shortly. Then there are some other applications that are coming, but they are not quite there, because they are this application of assist diagnosis that helps us to make the right call when we look at the images. The first one that I want to talk about is the solitary lung nodule. Of course, when you do a CT, in many cases, you find some surprises, like some smaller nodules within the lungs. And the big question is, what are these? Is that cancer? Is that just an inflammation? And if you don't know that, you have to do a monitoring. That is, the patient must come again in 3 months, in 6 months, to check on this nodule. And this is first, a radiation burden for the patient, and secondly, it puts a strain on the healthcare system. So if we could use the AI to tell us or to estimate whether the nodule is malignant or not, it would be great. And actually, there is this study that was published recently on Nature Medicine that examined more than 40,000 nodules, and it concluded that AI can help us in telling apart malignant from benign nodules. And then the last example that I wanted to make, that is, of course, the farthest off on the horizon, is the detection of microscopic disease. Of course, this is not about seeing something and just judging or telling if it is good or bad, but it is about seeing some disease that a human eye cannot see. For instance, patient with pancreatic cancer. Pancreatic cancer is very aggressive. So when I see the primary tumor on the pancreas, there is a big chance that the patient has already liver metastasis. But sometimes I don't see those lesions. And so I operate the patient only to find out that, the lesion on the liver have grown, and the patient is a 4-stage patient, and I shouldn't have operated this patient. So a possible application of AI is to identify the microscopic disease and to better stratify the patient and to decide whether they should receive one type of treatment, like localized treatment, versus a systemic treatment like chemotherapy. Of course, these last two applications require a large amount of data, and that is the point that we are making in this session. That is, we need packs, we need networks, we need data sharing, of course, responsible data sharing, to be able to train these models and for them to be reliable. And that is also what we will speak in the future, how to, in this session, on how can we attain the construction of these networks.
Thank you very much. So we have heard the clinical point of view, and we would like to ask Dr. Garbarino, who is the other side of the medal, let's say. So we wanted to ask the very same question. So on the mathematical point of view, so on the engineering, let's say, to make it broader, point of view, what are the skills and what are also the tools that are needed to go towards the clinical world and to tackle real clinical problems?
Yes, Lara, thanks. Thanks. Well, I guess this morning with Professor Ayash's talk, we had kind of an overview of all the technical, engineering, mathematical, computational, statistical skills that are somehow needed for this task. So being able to effectively apply AI into the medical imaging context. So we have a set of skills that relate to numerical methods for solving PDEs, for instance, related to biophysical modeling of tumor formation, tumor growth, cardiac functioning. So PDE, finite element methodology, Monte Carlo simulations. And then we have a set of skills that are needed that go towards the scientific computing, set, which is parallel programming, so containerization, workflow automation, and so on. And then, of course, we have a set of skills that are more theoretical in some sense. So you mentioned at the beginning the fact that, like, the first revolution was related to, the discovery of X-rays. And well, to get an image from X-rays, you need to solve an inverse problems, which is a difficult task from a mathematical point of view. So there's also a set of skills that relate to that, context, that talk about optimization, regularization techniques. And then, of course, the huge knowledge, essentially, of statistical modeling and machine learning, so Bayesian inference for probabilistic modeling, and deep learning tools. So this is, I guess, from a technical point of view, the set of skills that are needed. So I'm mostly talking to students probably. So like how to address your course of studies if you want to go towards this career. One thing that's not written here on the slide, but that I reckon to be, the major skill that you will need to develop is, being curious and being willing to get out of your comfort zone for studying things. So I'm a mathematician and I did my PhD in mathematics, but my PhD study, I collaborated with Francesco, for instance, and we discussed about the glucose metabolism in the kidneys. And I had no knowledge at all about these biological and biophysical things or chemical things. So I had to study that. And of course, my knowledge at the end of the day wasn't the same as Francesco or Professor Chiti, of course, but you have to be willing to get out of your comfort zone to study different things and be able to, enter the discussion with clinicians, which is the key point. So Lara asked, so what are the skills to bridge the gap, essentially? So, and we already discussed a bit with the previous speakers, and we already discussed this morning, and it's in the title of this roundtable. So the key point is, of course, interdisciplinarity. And really creating embedded teams between more technical people, mathematicians, statisticians, engineers, and clinicians. So I realized I've been working in one of these labs in the past 4 years, which is a lab of mathematicians and statisticians in an hospital. And I realized how many things I just didn't know, and by just being within hospital walls. For instance, you mentioned PACS just before, and I just didn't know that the PACS system was so heavy and wasn't interacting between different hospitals. So in our region, I'm from Genoa, we also don't have a regional PACS. So we had to, and talking with clinicians, we realized that one of the problems was how do we access the data that are in the PACS? We were talking about images there, and how do we, automatically select them and start some automatic processing for brain images? It was in that case MR images, and that was their needs. Just before, going to, tumor segmentation, like how do we access the data in a seamless way? And that was one of the things we've been working on in the past years, to get a system that is clinician friendly and is seamlessly integrated with the PACS and all these other tools that clinicians use on a daily basis to make it easier to use, because otherwise it's extremely time consuming. And so essentially, interdisciplinary collaboration is a tool. Embedded teams are, I think, the key answer to how to go toward bridging the gap. We are bridging the gap. We are there. We are getting there. We saw this morning. We are getting there. There's probably the last mile to do, but we are working there. And then there is, of course, one big issue and point that still needs to be, somehow, I think we need experienced people there, which at the moment it's not so common to find this type of experience, which is the experience about the regulatory and the ethical awareness of the tool that we develop on many different levels of fairness, explainability, patient privacy, differential privacy, and so on and so forth. So this is something we have to get, knowledge on. We have to get skills on, but it's getting there as well. So I'm really, positive. I'm an optimistic person. So I just, but I think we are getting there. We are. It's just a matter of time. And yeah, that's it.
Thank you. Thank you. It has been mentioned several times in this panel that, of course, besides clinical and methodological knowledge, we also need infrastructures. And we have mentioned how PACS has been created and invented, but it is not really accessible, or it should be accessible in a more improved and enhanced way. So as medical imaging generates massive amount of data and sensitive data, I would say, what are, wanted to ask you to Dr. Gatti, what are the biggest challenges in storing, retrieving, and also securing this data while ensuring accountable access for AI-driven solutions in clinics and also in company, and how scalable AI pipelines can be effectively integrated into the hospital environment? Thank you.
No, thank you, Lara, for the question. And before starting, thank you for having me. It's always good, let's say, to represent the technical point of view, the technology point of view, as well as, especially for me, it's always good to be back to my alma mater here at Politecnico. So, so it was a long introduction to my speech, the previous ones, because I mean we had a lot of point on infrastructures, interactions, communication, data access, and so on and so forth. Let's say that. Let me first demystify something. The latest advancement from many years now basically gives us a good technical background for solving the data storage problem. I mean, The point is not on the storage. Every tech company, for example, which of course is playing and working with the clinicians, with hospitals, with pharma companies, has, let's say, specific teams working on storage of medical imaging, for example. So even if it looks like a very specific thing, this is common in Microsoft, as well in Google, as well in AWS. So every tech company has these specific things. Why? Because, I mean, of course, there are many topics to be managed around data compression, around data standards, around the way in which you get and bring the data on, let's say, on the computer in the end, you know, on the storage. But let's say that this is an ongoing matter and something that for which there were a lot of advancement in the last years. What is the real problem is something that Professor Chiti already introduced, no, with the point of interactions. So the point is really how to use this data and how to prepare this data for artificial intelligence, because I mean, we can't give it for granted that these data are ready to be used by artificial intelligence tools. Also, when talking of the volume of data, probably you know that every artificial intelligence tool typically can produce more data than those that they consume in the end. So in terms of other, especially with generative AI models, other data that can be used, of course, within the concept of the application itself, or in order, let's say, to start other threads into that specific application or for other applications, So there's a big problem of data volume, of course, which can be solved and which is almost solved. There's a much big problem of data management on how to make all this data working together within the context of a single entity, like an hospital, for example, or like a pharma company, and especially outside of the context of a single entity producing the concept of interaction, as we said before. Indeed, one thing that is happening is very common on the market, maybe especially, let's say, from a technical perspective, we're seeing that in the US. There's a concept of network, which is, again, is common, no? And the fact that many hospitals, many entities are sharing their data in the end in order to make this information available for cross-entity research. Now, let's say that if we look, for example, at the concept called precision imaging network, you can Google it, basically, is happening in the US. You have 80% of US healthcare providers on this network sharing basically images across and medical imaging data, to be honest, across basically all of them, and giving them the possibility of putting specific applications that are built within the hospital or outside for a third-party technical provider, for example, in order, let's say, to make this application, let's say, working and producing clinical insights from this data. And that's a point. The other point is on, as we said before, on the data access and the fact that, of course, you need to ensure the maximum level of security. And it's not only, let's say, the cyber security part of the story, which is something that you need to bring into the consideration, but is also, here we're talking of patient data, so we are talking of people lives in the end, no? And the point is very specific also on how you ethically work and manage basically this data within the overall cycle, for example, of an AI application. And let's say that, if we look at the responsible access to AI solutions in the care, this is basically the main point of ensuring not only privacy, but being also accountable of the data that you're sharing from a patient perspective, and having fairness, not only in the way in which the humans are working with the data, but also especially in the way in which the artificial intelligence is working with the data. It's very easy, unfortunately, we know, to get to a bias and to get a biased model in artificial intelligence. How we know that it's very easy, and you all worked with ChatGPT, Copilot, and things like that. So you experienced on first hand the concept of hallucination. So getting, let's say, very strange answer from that. Now try to bring that kind of concept in an AI application that should work with the patient data. Of course, this required fairness. This required specific accountability on what is there. There's another point, which is a very important point by looking at the future and looking, let's say, at what's happening worldwide in terms of evolution of the AI application, which is, so Dr. Fiz used a very specific word, which is communication, no? Communication, let's say, we can say across all the different actors working, from the doctor, of course, to the researcher, to the software engineer, and so on and so forth. But with the new discovering within the so-called agentic AI, if you know agentic AI, basically, potentially you don't have humans anymore, or you have humans working with virtual science teams that are basically completely, let's say, self-sufficient or self-standing on their own, which is a risk, which is a big risk, and is a big point, of course. But it's this is what's happening, for example, if I think in many pharma companies in their own drug discovery, for example, processes and drug discovery area, as well as what's happening, of course, let's say in research hospitals, for example, having the possibility of having not one single artificial intelligence application, but a set of what are called AI agents, basically, each one with the specific skills, coming back to the point of the skills, working together in an agent workflow that is able, let's say, to execute a specific thread or a specific part of the research, for example, on their own. Now, this is possible only with a human-to-machine collaboration. It's not possible, let's say, of having these virtual science teams in the cloud somewhere, let's say, doing all of these things all alone, of course. But is going to be important in order, let's say, to use as much as possible all the data that are generated by artificial intelligence and, for example, in the medical imaging application, by giving the possibility, of course, let's say, to doctors and researchers, clinicians, to focus on the most important part of the research rather than working basically extensively also on what could be called admin task, for example, also getting this virtual science team supporting this activity. So long story short, which is a long story, but let's try to summarize as much as possible for this thing. It's very important, let's say, to look at the volume of the data. It's very important to look at the data access. It's very important to look at the ethical usage, the so-called responsible access or responsible artificial intelligence. But when thinking, let's say, to the interactions and communication and access as well, again, there is this concept of agentic AI, which is building basically the possibility of having your virtual science team next to your basically human science team working together and kind of eventually increasing also the amount of research and the amount, let's say, of information that can be leveraged. From an infrastructure perspective, we are still, let's say, not completely there. Of course, many things are needed also from a regulation perspective. But at the same time, the advancement, especially from the generative AI, the agentic AI, etc., are going, let's say, to shortcut a little bit the time needed to arrive at the level, at this kind of level.
Thank you very much. Okay. So we have heard the company side of the answer, and I would like to, in relation to this very same question, I would like to ask Professor Signorini, what is the university counterpart of the topic? And I mean the contribution of the university and academia in a twofold meaning. What is their role and the experience also of university in taking part and developing tools for spreading the infrastructures and also the tools to connect clinics with AI? And also, what is the role of university and academia in shaping the new profiles of students that are needed in terms of experience and knowledge that are needed to bring this gap also for future generations?
Okay. Thank you, Lara, for this invitation, and thank you to all the colleagues that have presented their point of view before me, because they all presented some keywords. That keywords are very important for all of us because they indicate interdisciplinary way to work in a world, not to work in artificial intelligence, but to work in a world that is changed, that is changed by the presence of the artificial intelligence. We all are involved in life sciences, and in the life sciences environment, the life sciences approaches, the artificial intelligence is playing a very, very important and is introducing a change of perspective. So Lara asked me, and I thank her for this question, to say something about the graduation paths. How as Politecnico we are working on this topic regarding the path, the educational path that we propose in our university. This was one part of her question. And first of all, yesterday when I came in this room, I was very I didn't expect to see so many students participating to this work. So that's it's a very important sign, and I think it's not only for food, yes, which is always an important point, but it's a joke, of course, but it's not for this. It's an interest that students themselves develop on this topic. So what we want to do, what we are able to do to help to offer something interesting for them in our university. So I read again the speech of our rector, Professor Donatella Asciutto, in the ceremony of the opening of the academic year. And she said a very important thing, a thing that is very important. She said that at the Politecnico di Milano, we are familiar with artificial intelligence. We evaluated, we worked in the strengths, weaknesses, opportunities, and also risks of artificial intelligence since 50 years. So that's enough. Okay. So in 1973, most of the audience, if we fix 1973, we remain in few people remain in this room. Okay. So it's a very very old data. So the first lab in artificial intelligence and robotics was founded here in the Politecnico di Milano. So these two things could be enough, but another point is important. Today is not the problem. Is no more, or it is, but only partially to to understand what the artificial intelligence is, what the big data are, things related to this. We develop knowledge about all these things in this year. Right now, the problem is a bit different. In which, in how to place this new technology, the artificial intelligence technology, in our environment, in our geopolitical landscape, I could say. So what is interesting, even I think for students, is to explore not only the practical application. Yes, we do it. We have courses inside our graduation paths, but even the ethical implication this technology possesses, and in the environment, in the topic like life sciences, this is even more important. So what we are doing, and we think we can do even to offer to our students a graduate paths that prepare them to be good scientists, good data scientists, is to include even these aspects, these not only ethical aspects, but fairness, the ethical use of the data, privacy, and how to manage all these technical things in a proper way. So one of the initiative, more recent initiative of the Politecnico di Milano was to introduce this meta department. This meta department involves also people from mathematics, and I see Anna, and the meta department wants to collect even professors and researchers to constitute a center which is multidisciplinary and works for multidisciplinary studies, technology and ethics, and involves engineers, architects, designers, philosophers also, and humanists. The very old engineers were a bit not suspect, but were a bit they did sure. Yeah, not sure about this choice, but I think it's in a world that is so made by interaction, by multidisciplinarity. We need to possess even this knowledge from the technical point of view, from the methodological point of view, but also we as engineers and architects and designers need to be to have even this kind of to possess even this kind of knowledge. So promoting responsible technological development. So I underlined in my slide the responsible AI, the term, the keywords of responsible AI that is associated to other keywords that have been used before. So the conscious use of the knowledge, so students with advanced knowledge, critical spirit, ability to ask a question and to find solution, and that are good for the entire population. So we are working to generate a new novel and engineers, architects, designers that possess all these characteristics. And this is why artificial intelligence is an integral part of our educational offerings. So we don't have at the Politecnico a graduate course in AI. Do you know this? We don't have a specific graduate course in AI. Okay, this is a this is a choice. I don't know if you. What do you think? What do you think the reason is? What do you think the reason is? Partially, I've spoiled the answer. And the answer is because the artificial intelligence is something that needs to be studied, to be studied in a more sorry, I'm a bit in a parola
Across.
Okay, sorry, across several different disciplines. So it's a kind of path that touch different disciplines. So this is the reason why we don't have a graduate path only dedicated to artificial intelligence. It has been a choice by the Politecnico di Milano. And so, and I wanted to underline another thing, which is the importance of working on the data, because data, as underlined by my colleagues, are the material on which the artificial intelligence can work properly. So data scientists are open to the use, the ethical use of data, the interoperability of data, the knowledge about privacy and fairness, and the importance of the integration and the interdisciplinarity with other colleagues. So that's what we wanted to propose to our students and to develop in our future thinking to the path, educational path for new engineers, architects, and designers. So responsible AI includes all these aspects. Just to close this view, here in the Politecnico, we are using the artificial intelligence to identify as early as possible dropouts that can arrive in students that are involved in graduate paths here in the Politecnico. So this is an example of how this algorithm can help the general population, can help the general population of students, can help the general population of people, of cancer people, and other applications. And so that will be our future, and I think you can be the students, the student that will be involved in this coming future. Thank you.
I thank you all. I thank all the panelists that we have had here today. We can also welcome some of the questions that may arise from the audience if you have any. But in the meantime, I wanted just to wrap up the key points that we have listed today. And I think that the key point, the primary key point is that we are at the front of the third revolution that we, as medical imaging scientists, are witnesses, but also medical scientists in general. And to tackle this revolution, to be at the right pace for this revolution, we need several skills. But since that one single person, one single scientist cannot know the entire, I mean, cannot be as exhaustive as the entire spectrum of knowledge. We need to contaminate one to each other, and we need also to collaborate. And so we need also to learn how to communicate and how to talk to other scientists coming from different backgrounds. And so I think that this roundtable and also the workshop can embody this call for interdisciplinarity that is needed for tackling the AI revolution in medicine. Do you have a question? Perfect.
I will start, but then I will leave to anybody else who wants. This is a bit provocative question for all the speakers.
Please,
because, I mean, the interdisciplinarity is a need, is a reality. We all agree on that. Now, especially for the elder person that are more experienced on that, and also for the companies, I would like to know your opinion on how to force this interdisciplinarity into university, into academic. Because this is my point in growing up people that is born as naturally prone to interdisciplinarity, but still meets some constraints and some obstacles in applying this concept of interdisciplinarity into science. I think that the medical imaging is a particularly suited field where this is clear. It is a field where we need to collaborate from the technician, ICT, storage, technology, and basic science to create something valuable. This is a recognized need. There are plenty of wonderful examples of how, when this happens, things are better, but we are still far, in my opinion, to have an efficient receiving part, at least in part of academics world. And I would like to know your opinion on how this might be enhanced, might be induced, might be enforced sometimes to create something that is more coherent with the claim of both companies and science in more interdisciplinary path and research.
Who takes the courage to answer this question? Well, we can start, yeah.
I can start.
Okay.
In my opinion, it's true. It's completely true. We have to transmit the interdisciplinarity as a value. We have to start this part, I think, culturally first, because we need to be all more convinced. There are some people already convinced on that, but not the entire population. And we need to work to affirm that the interdisciplinarity is not sometimes a waste of time, is not a degradation of our technical pedigree, but it's an opportunity, and it opens to more interesting things, I think.
I don't know if I can add something. Like, I have like a polemic reply
To a provocative question.
which
I think it fits, definitely.
which is that I think in Italy, having our, academic system that is so heavily relying on the SSN. We have scientific sectors that are like well defined within very strong boundaries, at least for our, engineering, mathematical, statistical environment. So this creates a state of mind in which interdisciplinarity sometimes is seen as, not a winning side, because you need to, follow along the path to get your career progressing within your specific sector. So I think this is a very, Italian thing. I'm not sure how it works in France, actually, or anywhere else. Yes. Similar, okay, voila. So this is something that's happening here, and this is, comes in between your career as a researcher, because you need to follow both routes, both paths somehow. So this is a thing, I think, that hinders this interdisciplinarity. But at the same time, I think all the graduate programs that are a bit interdisciplinary attract so many students, I think. They do. So the reality, the state of the fact of the reality is that these types of careers, they attract students which are interested in the possibility of integrating different knowledge from different backgrounds and creating their own career in a naturally interdisciplinary way. So this is the way to go, trying to, showing that these types of programs attract students, and so attract money, attract grants, and so on and so forth, and so we can leverage on that, hopefully.
Maybe I can add just one point. I think that, so totally agree with Sara on this point, and of course it's not only Italian thing. Let's say this is worldwide in the end, and I'll tell you a little story about that. I think that it's important for university and academia to list the possibilities, so to make it very clear in the programs, in the courses, etc. Which are the possibility of creating this kind of interdisciplinary scenario. And so sometimes it's even easier, than what we think. It's just, let's say, to give the possibility to the students to understand that there are this possibility, let's say, of putting things together. I was last week in the US. I was discussing with the chief research officer of a large pharma company, discussing this point of building the virtual science team, I said before, So who is going to build this virtual science team? You don't have Microsoft or Google or any other kind of consulting company, etc., building this team. This virtual science team, the science agent, is going to be built by the researcher, is going to be built by the people that are working on that point. But now, the immediate reaction was, my people are scientists, they are data scientists, or they don't know how to build agent, which was, let's say, coming back to the point of, it's another step in adding this skill. And the example is very simple in what you say. I mean, your people knows how to use Excel, for example, to analyze data, or your people knows how to, let's say, build Python applications, for example, for data analysis, etc. They can absolutely learn how to build an agent, for which there are a lot of, let's say, low-code tools today. But beyond that, they can absolutely learn exactly as they learn to work on Excel, or they learn, let's say, to work on Python. They absolutely can learn how to, for example, build an agent. Now, building an agent is not just for analysis, it's for, let's say, having much more possibilities and building your digital companion in the end, your artificial intelligence companion that can help you and support you. So this point is a mindset point, coming back to your question, for which you say my scope is the data scientist, which doesn't include building software or building, let's say, an agent that can help me. But this is not true, and we need to list these possibilities to the students, in order to get them and get them, let's say, approaching this kind of disciplines.
I can also chip in. Yeah, that is a very important question, how to motivate people to do this kind of research, because motivation is all, of course. And I think that the matter environment is partially the matter. Of course, we are talking about AI. AI is still, for the most part, a research application. So research is an obstacle runs. That's the problem. That if you want to study something, you need to get various type of approval from your hospital, from the ethics committee. You have to gather the money. You have to get you get to get financed. You get to stipulate an insurance for the patients. You have to do a lot of things, and sometimes you're just on your own, and you have to do all of this while you're working. And Professor Chiti can confirm that is really sometimes it's really overwhelming. So if we can foster a better environment for research in general, like better communication, easier legislation, less bureaucracy, then of course also cooperation, it will be more viable, and the research could be sped up, which we really need. So yes, people are, like you said, people are motivated, the infrastructure can be built, but also the process should be made more smooth. That's my view, at least, because I think that there is a strong drive inside all of us for a strong curiosity for discovery. But in order to get there, in order to get from the hypothesis to the results, sometimes you have to work for years and years and years, and you risk never seeing the results. So you're less motivated to start in the first place. So I think that in the whole, there should be a better infrastructure for this.
So we are talking about students, so undergraduate students. So I would like
Not
to come
only,
back.
I would add.
But,
Also researchers.
Okay. Let's start from the beginning. So I would like to underline what Sara Garbarino said before. So we have to think about the comfort zone. So you will find that 5 to 10% of us, they are not comfortable in their comfort zone. Okay, so they are not going to be a problem for you, because they will look around trying to find out something more interesting and with a broader scope. You have to work on the 80% of those students that they want to stay in the comfort zone. And this is going to be challenging. And I'm back again to what Sara Garbarino said before, that we are working in silos. But we see that the world again is changing, and maybe coming back to the early years of the last century, we understand that we cannot rely on just one kind of knowledge. So it's on us to make students comfortable in staying outside their comfort zone. Okay, and of course this is not going to be easy, but I think that we have to make a cultural change that make students aware that what is going to be your future person, that is the reason why you are going to the university. So how you can build your personality and your profession is based not only on a small niche, but on a wider knowledge. So in this case, we don't really need to work just on philosophy, on whatever, but we have to work on medical things. So being able to to have data scientists comfortable in medicine, I think that the best way would be to expose them to medicine, to medical knowledge. You know, there is a very nice example of this MedTech degree, which is not going to be let's say, fine for everyone. But I think that the easiest way would be to make medicine comfortable for data scientists. So to expose them and to make them understand that this is something that you can easily catch, because sorry for being really frank, but I think that let's say the general level of the student engineers, they are, let's say, more capable of understanding huge problems than the medical doctors. We medical doctors have to learn a lot of things, but reasoning then comes afterwards. But at the first year, you just have to digest a lot of a lot of information. So I think that exposing students to medicine would be the best way for you.
And I'm just the chair of this session, but I would also add something because from a younger point of view, I think that what is needed is a variety of role models that can actually, as you were also saying, that can point at the direction that we need to aim at. And I think that actually these days, this workshop is helping in this. We had a lot of examples of role models that interdisciplinarity role models that can actually be mimicked in a way. So I thank you all for being here and for this.